be under the table kind of function of your insulin is to affect your other organs as well. Like obviously your insulin is the hormone which is creating so many problems to all your organs, whether it's your adipose tissues, whether it's your non-adipose tissues, or it's your vital organs, like whatever the organs are there. But how it is going so far and giving you so many all these problems and issues related to it? Basically what's happening is insulin is that hormone which has been secreted by your pancreas in relation or in terms of their uh, uh, signal what you are eating from your food, right? So whatever the type of food you are eating, it is going to uh, give your pancreas a signal to release insulin in response to that. And as a result of that secretion from pancreas, this hormone is going to start its function on the food you have eaten, right? Its major and its prime and its first and foremost function is to control whatever food is coming up to your digestive tract. And later on in the liver, it is going to help your liver to function on all the issues or all the processes related to the digestion and the assimilation and the absorption. So in your liver, all the functions and processes like gluconeogenesis, glycolysis, and glycogenesis and lipogenesis, all this is happening there with the help of insulin itself. So at the first side, जो पहला काम है your insulin is doing, it is actually converting your glucose into glycogen for the stress related conditions. That whenever you are in stress is what? Whenever you are doing anything extra and you have not eaten anything, right? Then the energy coming from where? That energy is coming from your glycogen, because at rest the energy is coming from fats itself, and fat is stored in your adipose, right, tissues. So at rest the fat is your energy substance. बट एट द टाइम ऑफ वर्किंग, जब आप कुछ काम कर रहे होते हो तब क्या होता है? At that time your glycogen is giving energy, so this glycogen is actually helping your body to sustain and to live a healthy and normal life during your all the activities mechanical, right? So this is how this insulin is very helpful. But in terms of whatever you have eaten or whatever the problems related to some sort of your bodily or genetical, nowadays it is the lifestyle, obviously. So whenever you are having a bad lifestyle, sedentary lifestyle, and eating more of the junk and fast food and refined and excess, then the insulin is secreted in very high amounts, which is not like able to be controlled by your organs and tissues like at a normal pace. So at that time, what's happening? The insulin, which is secreted so much in amount, will going to circulate in your body, in your blood, here and there, and it will find its place to stay, right? So in that sense, what is happening? That insulin will go to its unusual places where it is the last resort for insulin to stay. So it will start attacking your other organs as well, and especially your blood vessels, your non-adipose tissues, your every organ. So in that way, when it is coming to kidney, then it is going to affect the kidneys. So this is how this insulin resistance, because now what is happening over the period of time when you are keeping on like living the very sedentary lifestyle, very bad lifestyle, that insulin spike gradually and chronically will going to make this insulin resistance, because this pre-insulin is somewhere disrupting the normal metabolism of insulin as well. So at that time, what is happening? This insulin become non-functional and doing its those work, those functions which is not at its first place. So it is affecting all your organs, name like your heart, your GI tract, your liver, and kidneys, all other glands as well. So this is how it is going to affect. But today here we are going to focus on insulin resistance and kidney disease. So before starting or moving on to this kidney wala part, we would like to explain some reasons behind insulin resistance as well. name them is like initially insulin resistance was not a big problem and not a widespread problem. So at that time the genetics was the major reason or factor which is playing a biggest role in the insulin resistance. After that the lifestyle becomes like that, so obesity problems have started, that obesity is also contributing into your insulin resistance. Then the physical inactivity, we are now surrounded with all the machines and automated stuff, so that nowadays we don't have anything to do on our own manually. Apart from this unhealthy diet, high sugar, refined carbs, stress is also the major contributor of your insulin resistance. Sleep deprivation is there, and certain medications, which are generally the hormonal pills or some sort of psychotic drugs or whatever. So this is how these are the major factors in your insulin resistance which are aiding into. But when it comes to the kidney diseases relationship with insulin resistance, it's a bidirectional relation. How bidirectional? Like you cannot say कि insulin resistance हुआ था तो kidney diseases are started. Also, it has been affected in a way that if kidney diseases are there, insulin resistance might also start. So it's a bidirectional. If insulin resistance is there, kidneys will be affected. If kidneys are affected, then insulin resistance might there. So all this relationship we are going to study in our today's webinar. So till here, if anyone wants to add something or wants to ask something, I'm open for the questions for 2-3 minutes. Then we will be moving on to our next segment, kidney diseases. You can write your questions in the chat box, or you may just simply ask your questions. All right. So if you have any questions, you can ask me. Otherwise, I'm moving on to the next segment of the webinar, which is kidney diseases and its relation with insulin resistance. I would really be happy if you will be switching on your camera so that it will be an interactive session. Yes, who's this?
मैम आई वाज आस्किंग, आपने एक पोल डाला था ग्रुप पे कि इंसुलिन जो सॉरी किडनी डिसीज ओबेसिटी से रिलेटेड है, बट आज तक मैंने जितने भी मतलब अपने आसपास क्लाइंट्स देखे हैं, पेशेंट्स देखे हैं, मैंने तो ये देखा है कि अगर वो किडनी पेशेंट होते हैं तो वो बहुत लीन होते हैं.
No, it's not like that. Kidney diseases are generally affecting your body's composition when they are at their end stage. You will be finding their GFR is generally below 30 or 20. Then they are very lean, right? Or in the sense when they are having a specific problem of protein in the urine, proteinuria is there. Then only they will be like very lean. But generally, kidney patients are not very lean because kidney, like just I told you, कि किडनी की जो प्रॉब्लम्स हैं वो आपकी इंसुलिन रेजिस्टेंस को एग्रेवेट करती है, एक्सेक्रेबेट करती हैं. So in that sense it is actually increasing into obesity as well, and not like the fat mass is increased so much, but also it is aiding into the water retention in the body as well. So that is also like direct or indirect is reflecting into the weight and the a general appearance of the person. So that's how the kidney diseases are adding on to obesity. It's not like कि 100% kidney disease है तो वो obese ही होंगे. But yes, it is also a very untouched kind of segment of kidney diseases which is affecting your body's weight as well. You will find kidney patients का जो weight fluctuations है on everyday basis. आज उनका 75 है, कल उनका 80 मिलेगा. That way it is happening. Like my I am having my patient at Gangaram. She is a 40 years old lady, and to be honest, उन्होंने मुझे सुबह अपना वेट बताया 88, and the next same evening she had told me it's 93 kg. So that's how it is fluctuating so much. So that is the way, like people generally don't find a link between the weight fluctuations and the kidney disease, but it is because of the kidney diseases. Until the evening in the sun is like getting down, then at that time because of your hormonal changes and your water retention, because throughout the day people are being active, so water retention a bit more at that time, right? So this is how people are having this weight fluctuations and obesity, or you can say not obesity generally we sense in a way that only related to the weight, right? But actually obesity को अगर आप deeply study करते हो, so it's related with the fat to muscle mass. But for
हाँ,
a general case scenario,
कौन?
sorry, who's this?
हाँ तो कर रही होगी, कहीं और तो काम करेगी वो.
Please mute yourselves. Yeah. So what's happening is whenever your weight is fluctuating, you need to focus on all the aspects related to the water mass, related to your fat mass, related to your muscle mass. Generally, people are very confused with the things that आज हमारा weight इतना हो गया है, especially with दिवाली के बाद. Like you will find Instagram, Facebook, YouTube is flooded with the detox, detox, detox. Like why to worry about this? This is just a temporary and momentarily kind of weight, right? Which is the water retention. So the better you live, the healthily you live, and the good lifestyle you are following, everything will be coming into its natural and normal way back, right? So this is how kidney diseases are affecting your obesity as well. Now switching on to kidney diseases, before knowing about kidney diseases, we should be knowing what is kidney. So kidney is a part of your excretory system, a paired organ, right? Which is having a bean shape like structure. On top of them, the adrenal gland is there, and majority of your body's hormone to regulate your metabolism, to regulate your homeostasis, are secreted by that gland, right? And same, the kidney is also being regulated by that gland, which is situated at the top of your kidney. So in kidney, there are two regions, cortex and your medulla. Cortex is the outer, medulla is the inner, and in the medullary region, there are the nephrons. Millions and billions of nephrons are there in each kidney, which are the filtering unit of your body's blood, right? So major functions of kidney are to filter your blood, to maintain the blood volume, to maintain the bone health, and to maintain your nervous system activities as well. You must be finding whenever you feel anxious, you find giddiness in your belly, right? That's where the part of your kidneys is coming into, right? So this is how it is very important to have a healthy kidney, because all the waste and the toxins which are not even being cleared by your liver are to be excreted by kidneys only. So kidneys are very important organ of your body. That's why it is in pair as well. Like if you have any one kidney is non-functional or having the less functionality, so the other kidney is there to maintain your health. So this is about the kidney. In kidney there are certain other functions are also being done, like blood pressure management is also being done by your kidneys with the help of adrenal gland, right? There also insulin is playing a very important role. So this is how it is. And the rate at which kidney is filtering your blood is known as glomerulus filtration rate. So generally kidney में अगर आप देखोगे, so inside the medulla there are different like millions of the nephrons. So nephrons का structure क्या होता है? It is having a cup like shaped structure which we call as Bowman's capsule, जिसके अंदर tuft of capillaries is there. Tuft of capillaries is your all the arteries which are bringing blood into that for the purpose of filtration. So now, from that Bowman's capsule, there is an extension of a pipe-like structure which we call proximal convoluted tubules, and from there, a very thin, again pipe-like non-convoluted structure, which is hairpin-like structure, is known as loop of Henle, and then it is ascending. Then after ascending, it is again converted into convoluted tubules, which is the distal convoluted tubule, because it is at a distance from your Bowman's capsule and the proximal convoluted tubules. After that, it is finally attached to a common tubule, which is linked with the ureter, which is the common urinary pipes, right? And then further, it is attached to the this urine bladder, right? Where it is coming out as a part of your micturition process, which we call as urination. So this is how the whole excretory system is there, and of that excretory system, one part is there which we call kidney. That's how nephrologists are different and urologists are different. Urologists are generally dealing with all the issues related to the ureters and your urinary bladder, right? So this is how it is happening. Now in kidney, the very first problems are starting with the kidneys itself. अब किडनी में जो फिल्टरिंग यूनिट है, जब वहां पे प्रॉब्लम आना शुरू होता है, देन द स्टार्टिंग ऑफ योर प्रॉब्लम्स इज हैपनिंग, right? So how insulin resistance is causing all those problems? Let's talk about first about the issues, what all can happen to your kidneys. What all diseases about kidney you know till date? Like क्या क्या issues हो सकते हैं kidney damage होने पे?
मैम किडनी स्टोन्स हो सकते हैं,
Yeah,
किडनी फेलियर हो सकते हैं,
yeah. Inflammation and filtration of filtration units. Yeah, nephrons are been inflamed, of course.
मैम जब प्रोटीनोजोरिया होता है तो वो फिल्टर का पार्ट खराब होने का चांसेस होते हैं।
Yes, exactly. So kidney diseases generally are of three types: chronic kidney disease, diabetic kidney diseases, and kidney failure. Among all these three diseases, what is happening is there are different stages, and you can say phases of your problematic kidneys, which are known as the different kidney diseases, right? So just like kidney stone formation is a different disease, then coming on to chronic kidney disease, उसी के अंदर आपकी multiple range of symptoms are coming, which we call as kidney disease as well, right? So chronic kidney disease is a stage or gradual damage to your nephrons, which is the filtration unit of your kidney. After that, diabetic kidney disease, it is generally happening because of the diabetes itself, and diabetes we not directly linked with insulin itself, right? So here this particular type of disease of kidney is linked to insulin directly, right? After that, coming on to this end stage renal disease, or you can say the kidney failure is also associated with the insulin resistance. So first we talk about the kidney stones because it is a different branch kind of thing, and later the other diseases are generally in one go itself, where we can have established, like we can establish the link with kidney and insulin resistance, right? So kidney stone formation, what is the major category of kidney stones? Like what type of kidney stones majorly you find in patients, in people?
Calcium, ma'am.
मैम
Calcium.
कैल्शियम,
Yeah. So you must be finding, yeah, who's this? Oxalate stones. Yeah, this is how struvite stones, pyruvate stones, oxalate stones are also there, but they are not of the major category. The major category of kidney stones is calcium stone, right? That's why you must be finding kidney stone के disease में सबसे पहले calcium restrict कर देते हैं without knowing any other, like the type of kidney stone. There are dietitians, there are doctors who just restrict the calcium in their diet, right? But it is not about calcium only, but yes, the major type of kidney stones is of calcium stone, right? So how this calcium stone is formed? We all know that kidney has ability to filter all the you can say particles or substituents in the blood which is coming for the filtration to it. Now what kidney is doing, kidney has a threshold for each and every molecule which is coming to it, right? So जैसे ही वो threshold increase होता है with kidney's ability to pass it out in the urine, it starts accumulating over there, right? So similarly happening in the calcium case, when calcium is reaching to its threshold and supersaturates in the kidney, in any part of your kidney, of your nephron, then it starts accumulating. So it can accumulate even in the medullary region, or in the cortex region, or in the ureter, right? So this is how the different locations might find. That's how the scan is required to detect at what place the stone is being formed and at what place the stone is being stuck, right? Generally till ureters, it is the passage or flow of that stone which has been formed at the medullary part. Majority of the times the kidneys stones are formed at the medullary region because nephrons सबसे ज्यादा उसी area में होते हैं, right? Cortical nephrons बहुत ज्यादा नहीं होते हैं और उनका function भी a bit less होता है than the medullary ones, right? So that's how major like remarketing site for your kidney stones is the medulla. तो वहां पे आपके स्टोन्स फॉर्म होते हैं. नाउ हाउ इट इज लिंक्ड विद योर इंसुलिन. Insulin is the hormone which is actually just like I told you कि आपके हर एक organ, हर एक gland को it is giving its functionality to giving its metabolism and regulation. So what's happening is when insulin's general function is to activate your parathyroid gland as well. And your parathyroid gland's function is to leach your bones for increase into your blood calcium concentration or amount. So that way it's a general case scenario. But what's happening in insulin resistance? I told you free insulin है, बहुत सारा घूमता रहता है, right? तो वो क्या करेगा, हर एक organ के पास जाएगा, उसको damage करेगा. So similarly it is increase the parathyroid hormone activity. So this is how a parathyroid hormone is increased. So bones will start leaching its calcium into the blood, and this is how blood calcium is increased. And also, just like I told, some relations of insulin resistance and problems are bidirectional. Just like kidney, parathyroid का relation is also bidirectional. अगर parathyroid hormone में problem है, gland में problem है, then insulin resistance भी होगा. So a vicious cycle will start. क्योंकि इंसुलिन ने पहले पैराथायरॉयड ग्लैंड को हैम्पर किया, देन पैराथायरॉयड ग्लैंड की हैम्पर और डैमेज की वजह से इंसुलिन रेजिस्टेंस इंक्रीज हो रहा है. So it will a vicious cycle which you cannot stop easily, right? So that way calcium will increase. Now your kidneys will try to filter it out and to remove it out in the urine. But what's happening, जब ये अपना threshold पार कर देगा, then simply your calcium will start accumulating, right? And this is how the calcium stone is formed. Also one more reason is there in the calcium stone formation with insulin resistance, right? Is that insulin resistance, we all know, is increasing into ketosis, right? Ketosis is the phenomena or the process happening for your blood. Blood का pH low हो जाता है, right? अब blood pH low होने पे kidney has to make urine more alkaline, right? So urine is already so much alkaline by a general homeostatic mechanism that now it lose its ability to dissolve more calcium in it. अब यहाँ पे calcium is not reached to its threshold, but general homeostatic mechanism because of kidney, this insulin resistance, that the ketosis is there in the blood, then what's happening is आपका urine will not be able to dissolve calcium so much, and it will start accumulating again, right? Because if something is not going into urine, where it will go? It will retain at the tissue side, and tissue वहां पे कौन सा है, kidney का. So that's how calcium stones are formed as a result of insulin resistance. So this is the very first link of the very general kind of disease which most of the people are not even thinking that it's a disease, right? Okay. Stones on, people are taking it so casual and so normal, but the pain it is giving, right, the type of suffering it is given, it's way more you can say painful and can even life threatening at some points. It requires the injections, instant injections, to subside its pain and its symptoms, right? So that's how it is happening with insulin resistance. So obviously we have to focus on to increasing our insulin sensitivity, even to uh, uh, like get rid of the calcium stones in the kidney, right? Next, coming on to your our kidney diseases, like how insulin resistance is affecting your kidneys. What insulin resistance is doing? Insulin resistance से आपकी body में क्या क्या changes आते हैं? Like what all you know? Anyone? Either you can write in the chat box or you can simply ask me or tell me. Sorry. Yeah. Insulin resistance से what all problems you have seen, you have studied, you know till date कि क्या क्या होता है body में?
I mean, it is directly related to CVD. So,
Yeah. Yes, of course. What else it is doing to your body? PCOS, diabetes, yeah, of course. But these are the manifestations which you can see. At the cellular level, what it is doing? It is increasing into the blood glucose, right? It is increasing into the inflammations by increasing the cytokines, right? It is increasing into the oxidative stress, right? It is also increasing the blood pressure, right? It is increasing the lipotoxicity. What is lipotoxicity? Lipotoxicity is generally a process or phenomena which is actually the accumulation of fat in the non-adipose tissue, right? So these are the major or many, you can say, things which have been changed in your body, and as a result of those changes in your body, your different manifestations is coming out into the result of the diseases, just like the diabetes, PCOS, or DKD, or any sort of CBD, right? So these are the manifestations. But how these manifestations are coming? Because of these changes at the cellular levels. Now, let's first talk about the blood pressure. Like we all know, blood pressure is a simple thing which is actually primarily linked with the kidneys and the heart. So kidney and heart is directly linked because obviously blood is pumped by your heart and filtered by your kidney. So they have a direct relation, right? So obviously whatever the type of manifestations are there of your heart diseases or kidney diseases must be linked together. That's how blood pressure is also known as pulmonary blood pressure, and you can see the systolic diastolic kind of. So this is how it is happening. But generally, what is the blood pressure? Like what is blood pressure disease, hypertension, which we call? What do you understand by this? Hypertension में what type of manifestation you are seeing? Like patient को क्या problems होते हैं? No idea.
Ma'am, when the systole and diastole level is not up to 120 by 80.
Okay. Risk of severity, yeah, obviously. So basically what's happening is blood pressure or hypertension is the condition of your body where systolic and diastolic blood pressures are not in the ranges and increased because it's hypertension. Hyper means increase is there in something, right? So tension is the force of action onto your blood vessels by your blood, right? So this is what we call as hypertension. Now generally it is happening because of the kidneys impairment or any sort of changes in the kidney, just like there is the adrenal gland which is secreting a hormone. Yeah, damage to endothelial cells as well, that's good. So what's happening is the aldosterone hormone is being secreted by your adrenal glands, which is actually regulating your kidney to retain sodium, right? So now sodium retain will be maintaining the osmolarity of your blood and maintaining the blood pressure. But this is the case when your body is having a signal of low sodium. What is the like not so normal or natural case scenario is when insulin resistance is there, it is adding on to its activity of adrenal gland to release more aldosterone. So this aldosterone, like irrespective of the fact that sodium is high or low in your blood, will start retaining again into your kidneys, right? And will be circulating in the blood. Now, sodium being on higher side is going to aggravate the pressure in your blood, right? So this is how blood pressure is increased. This is the one way of insulin resistance, which is this like by which it is increasing the blood pressure in your body. There are some other ways as well how insulin resistance is increasing blood pressure. Insulin is also activating the sympathetic nervous system, and your sympathetic nervous system is associated with the stress and all those activities. So in as a result to that, it is increasing into your heart rate and your blood pressure. So this is how again it is going to increase in that, right? Apart from this,
Ma'am,
insulin.
can you tell about sympathetic nervous system?
Sympathetic nervous system is your what we call flight and fight response, right? So it is the response of your body as a manifestation of your adrenal glands at the time of stressful in activities, when you are feeling some sort of unnormal things in your body, just like palpitation, just like sweating, just like sudden sort of shivering and trembling at the time of stressful events, right? So this is actually been regulated by your this adrenal glands, and adrenal glands are situated on the top of your kidneys. So this is how I already mentioned in the starting of the kidney segment, that adrenal gland is having a wide range of hormones which are controlling your body, and this is actually important as well. Obviously you will find all that link there in the topic which I'll be covering in your upcoming topic of the internship, right? So there I will be covering all the aspects related to the sympathetic nervous system as well, right? But here our focus is majorly on the insulin resistance, right? So apart from this, this insulin resistance is doing
Ma'am,
your, yes.
ma'am, we were discussing about the hypertension or the BP in the higher case. How about in case of low BP, or is it the same way working related with the insulin resistance and the kidney disease?
Can you please write your question? Actually, your voice is not that clear. I cannot get you.
Okay, ma'am, I just write it down.
Please write it down. So, apart from this, your insulin is also doing one more effect to your blood vessels, which is vasoconstriction. So, vasoconstriction is the phenomena where your blood vessels are being shrinked, constricted. Because of that constriction, the pressure which is flowing into your blood vessels is increased. So, that's how it is again increased. And directly or indirectly, this vasoconstriction is going to affect your kidneys in longer run, because the increased pressure of blood towards your kidney will again going to cause harm to that as well, right? Yes, Divya. In case of low BP, what is the relativity between insulin resistance and kidney disease? Generally, in low BP, relative relation between your insulin resistance and kidney disease is of your hypoglycemic events, right? Whenever your sugar is low, your blood pressure will also fall, and this is also just in the case of very high circulating insulin in terms of your either its sensitivity, right? So this is how when your body finds an event of your low sugar, right? And low sugar will then going to affect your give a signal to your brain and then to the kidneys to increase into that, and low sodium to increase into that. And this is how, if this is a very vicious, or you can say chronic kind of cycle which is happening frequently, now your kidney is used to secrete more of the sodium to maintain or to increase into the blood pressure, right? So hypoglycemia nowadays is being considered as a different type of disease itself. It's an individual disease, but anyway they both are not at the first place directly linked with this particular phenomena. But yes, it is also a manifestation of the insulin resistance happening, because insulin resistance we know is causing diabetes, and then diabetes, when it is uncontrolled or you can say not regulated or managed one, then it might cause the events of the hyperglycemia or hypoglycemia. And nowadays surprisingly I am finding even my patients as well at the hospital, they are having hypos so much, right? Because of in the name of managing their blood sugars, they tend to avoid eating some sort of things, or they might be having stressful events. So as a result of all these, they are having hypos nowadays very frequently. So this hypoglycemic event is actually creating, so yeah.
Ma'am, does aldosterone play a role in low sugar level because of sodium retention problem?
No, sodium is aldosterone is increasing the sodium. So that increase in sodium is again going to have increase in your blood pressure. It is not directly linked with the sugar, but yes, your sympathetic nervous system is increasing into your sugar levels, not the lowering ones. Lowering of your blood sugar is directly related to the insulin, not to the other factors. But yes, increase into the blood sugar is related to so many factors. It's related to the stress, it's related to the insulin resistance, it's related to your aldosterone and all that stuff. Does stress also increase aldosterone levels? Yeah, it is actually. At the stressful times, your adrenal gland is in action, and in that action, it is increasing its hormones, which are there for the stressful environment. Low sodium is also a stressful condition for your body. You feel like very low in energy, right? So that's how different type of stresses are increasing different type of hormones, right? So this is how aldosterone is, of course, a stressful hormone for your body, which is actually coming into the picture to manage that stressful event, right? Okay. Apart from this, endothelial damage is also one of the thing which has been caused by your insulin resistance as well. How it is doing so? Because at the time when insulin is circulating freely, and it will finding its space to stay for longer, right? So it will actually going to affect your body endothelial cells of blood vessels, and as a result, the cells of endothelium layer of your blood vessels are also responsible for like liberating the. Can you please mute yourselves? Are you asking a question? Yeah. So what's happening is, yeah, your endothelial cells are liberating nitric oxide, which is actually responsible for the vasodilation. So, at the time of insulin resistance, your endothelial is also been affected, and your nitric oxide liberation is also been reduced. As a result of that, what is happening is your vasoconstriction will start again, and no vasodilation will be happening. So, this is also a contributing factor into the increased blood pressure. And the inflammation, we all know it is the inflammation to all the cells of your other organs, and like you name any organ and the cells will be inflamed if the inflammation is started chronically, right? So this is how it is actually affecting. So blood pressure is also been a manifestation of insulin resistance only. And if blood pressure is increased sooner or later, because in the name of treatment of your blood pressure, the drugs which are being used and the unnecessary stress it is causing to your kidneys are going to increase into the kidney diseases, just like your GFR reduction and your osmolarity, you can say disbalance, pH disbalance, and this is how kidneys are going to have its effect on it, right? And other kidney manifestations will start coming. Now, coming on to the next segment, which is the lipotoxicity. Lipotoxicity, just like I told you, people, it is the accumulation of fat into the non-adipose tissues. Now, kidney is also one non-adipose tissues. It is not meant to store the fat. This lipotoxicity is actually creating so many problems in your body, right? There are various mechanisms to that. Like when the fat is being started accumulating, what type of fat is accumulating? It is the saturated fatty acids, right? It is forming the ceramides. Ceramides, I will coming on to that as well. It is also increasing the diacyl glycerol, right, which are also causing so much problem to all your organs. And it is activating some factors which are directly increasing the protein secretion into urine, right? Apart from this, it is generally affecting the insulin signaling, just like increasing the visceral fat around your vital organs is adding into the insulin sensitivity, like reduction in the insulin sensitivity. So how it is doing, you can say, causing its adverse effect on the kidney health. It is actually creating renal fibrosis. How it is doing so? In your kidneys, there has been starting the accumulation of fat around it, and as a result of that, some sort of ceramides, the type of fat, a special type of fat is there. Ceramides are the type of lipids which are the molecules playing a crucial role in cellular signaling and membrane structure. So when this ceramide are required in very minute amount, not so much amount, but as a result of your lipotoxicity, ceramides formation is increased. So as a result, membrane structure is disbalanced in a way कि वहां पे उसके around एक layering form होनी शुरू हो जाती है, which we call fibroids. So kidney fibrosis is started as a result of lipotoxicity, and this membrane could be of any tissue of the kidney, any cell of the kidney, and the major cells of the kidney are nephrons, right? So this is how it is creating stress on the nephrons as well. Apart from this, this ceramide is causing the podocytes to natural death. Now, podocytes are what? I will coming on to that as well. But before that, let's just finish with the ceramide wala part. So these ceramides are causing fibrosis in the kidney tissue, causing oxidative stress because आपके जो cells हैं kidney के उसके across transportation is not possible, right? Because क्योंकि layer is been thick, right? Apart from this insulin resistance, it is causing, right? So this is how these ceramides are causing problem to your body as a manifestation of lipotoxicity. How other parts are being affected of your kidney as a result of this lipotoxicity? Your impaired glucose metabolism as well to all the cells of your kidney. Like we know, glucose is the major demand of all your cells to thrive, to sustain, to live, right? Because the energy is being taken up by glucose only, like in the form of glucose only as a result of glycolysis and the ATPs. So this is how kidneys की functioning भी उतनी efficient नहीं रहेगी. So it is causing all these problems. What all type of tests you can avail or you can go for to knowing the status of lipotoxicity and all that stuff? You can just simply check onto urine lipid profiles, right? Serum triglyceride of your blood, fasting insulin levels, hemoglobin, like which we call the HbA1c, right? Apart from this, kidney function test where GFR and creatinine, everything will be there. So these tests will going to help you in detection of your lipotoxicity caused by the insulin resistance, right? So I hope till here everything is clear. We have discussed three parameters: calcium stone, hypertension, and lipotoxicity, right? Any questions so far? I am open for 2-3 minutes.
Ma'am, please repeat this last one, kidney wala lipotoxicity. In
Okay.
short.
In short, yeah, sure. Lipotoxicity is just the condition which is being done by your insulin resistance. Insulin resistance कैसे करता है? Insulin is also the lipogenic hormone. Primarily, it is the anabolic hormone जो कि आपकी muscles को grow कराता है. But secondarily, it is the lipogenic hormone, right? So when insulin is resistant, it is just increasing into the fat, right? Which has to be stored at first place into the adipose tissues. But as insulin is resistant, so free insulin is so much and more of the fat is synthesized in the body, which is the saturated fats and all the type of triglyceride and diglycerides, right? So where all these will go? They will go into the non-adipose tissues, and as a result of that synthesis in the non-adipose tissues, your fat is going to cause some sort of changes in the leaning of those organs, right? अब जो वो organs हैं जो change हो रहे हैं जिनमें problems आ रही है, they will start have fibrosis, they will start have ceramides, they will start have the hampered pathway of the nutrient uptake and intake, that way. Apart from this, it is also going to affect the insulin sensitivity in those cells. Like already insulin resistance sensitivity was very less. Adding on to this factor, the other like whatever the cells were sensing insulin, they will also be blocked because of the accumulation of that fat around the membranes. So this is how lipotoxicity is affecting the kidneys. In specific kidney cases, it is affecting your two things, like kidney fibrosis is starting and podocyte damage is there. I will be coming on to podocytes now. So this is about the lipotoxicity, and the test panel I have told already. You can go for
Yes,
the,
ma'am.
yeah. So now coming on to podocytes. Podocytes
Thank
are
you, ma'am.
the, yeah. Podocytes are your specialized cell of kidney which are doing major functions of filtering waste and excess fluid, maintaining GFR, which we call as glomerular filtration rate. So there is a barrier of that rate as well. Obviously बीच में कुछ barrier होगा तभी तो वो एक pace maintain रहेगी ना. If there is no barrier at all in any flow, so there will be no any rate. It will keep on flowing, keep on flowing. So there is a barrier. So that barrier is being maintained by the podocytes. Podocytes are the cells which are having their pods, and they can make the movements by moving their like pods. Pods are actually the literal meaning of pod is the legs, you can say, cilia and flagella kind of formations onto the cells, right? Apart from this, it is also regulating proteinuria, like protein in urine. So what's happening in case of podocyte damage? Like insulin resistance, we know till here कि आपका insulin resistance क्या कर रहा है? Increase कर रहा है fat accumulation, and that fat accumulation is increasing into ceramides, and those ceramides are increasing into the natural death of your cells of kidney, which are the podocytes. So अब अगर podocytes will be died naturally at a faster pace, even when they are not designed or at a point of, because I hope you all are aware of apoptosis. Apoptosis is a natural death of the cell at the right time, right? So when any sort of apoptosis changes are there in the any tissue's cellular level, it is just damaging that tissue so much. Now here in this case, podocytes are now been forced to kill themselves naturally because of these ceramides. So now what will happen is your body kidneys GFR will be reduced, because it is the function of the podocytes itself. Then it is also like less filtration of waste will be there, more of the toxic elements will be staying in the blood for longer, and that's how your blood is being intoxicated again and circulated in a impure form towards other organs, right? Apart from this, kidney fibrosis is there, which generally requires surgical treatments if it is increased so much, right? Apart from this, it is also increasing into CVD, because the high sodium flowing over there, because filtration to proper ho nahi raha hai, so sodium will be coming back into the blood, and other elements will also be coming back. So this is how the fat will also be coming back into the blood, which will not be cleared by your urine and the filtration process of the kidney. So this is how it is going to create the cardiovascular diseases, it is going to create the blood pressure problems, it is going to create the reduce in GFR, right? So also the biggest thing which the question you I guess some one of you have asked कि kidney disease में generally lean people देखने को मिलते हैं. So this is when the case of podocytes are been damaged so much that the protein in urine is leaked so much, right? And this is how the urine will becomes very effusivate, like kind of whitish appearance, or having effervescence in it, right? So this is the case of protein leakage in urine. It is actually the scenario when podocytes are damaged. And podocytes, now we know ki insulin resistance is the major reason behind it, which is damaging your podocytes. So what all tests you can go for the check, like for keeping a check onto this particular condition of your kidney, you can check onto the urine protein to creat ratio, which we call PCR, serum creatinine, GFR, insulin levels, and HbA1c. After that,
मैम इंसुलिन लेवल कैसे चेक होगा?
insulin level check करने के लिए you have to go for some certain tests of insulin sensitivity. One is the insulin sensitivity test, which we call IST, homo insulin resistance, homo IR, which we call, or simple insulin fasting, and insulin PP, which I already has mentioned in one of my Insta live. The video is available over my Insta page. You can go to that, right?
Okay, thank you.
Yeah. Apart from this, now how this insulin resistance is increasing into the grades of different diseases, different we can say stages of reduced GFR. Like I told you कि किडनी के पास हर एक न्यूट्रिएंट का एक थ्रेशोल्ड होता है. If it is coming below that threshold, kidneys are working efficiently. But it is the case when something is reaching to its threshold, is certainly going to affect your kidneys. And this is the case when insulin resistance is there. We all know its biggest manifestation into your body, into your blood, is hyperglycemia. So it is the case when hyperglycemia is happening. Your body has different mechanisms to control over that increased blood sugar. अब वो increased blood sugar maintain करने के लिए body इसको अलग अलग काम में लगाएगी, right? And what all these works are: fat synthesis, right? Apart from this, atherosclerosis, keep accumulation over the around the organs. Apart from this, glycogen synthesis, but glycogen being the least one, because glycogen की synthesis तभी होती है when insulin is sensitive. When it is insensitive, it cannot form the glycogen. It will just form the fats molecule only. Okay, if the kidney parameters are fine and GFR is between 70 and 80 for age between 50 and 60, is it a concern? No, it is not a concern. I will be coming on to these grades as well. What is the GFR? How GFR is reducing? What are the effects of it? And for a person of 50 to 60 years age, it's a general case scenario, right? I obviously in today's time जो हम lifestyle जी रहे हैं ना, उसके साथ में यू कैन आई कैन बेट ऑन टू दिस कि आप किसी का भी टेस्ट कराओ लिवर का और किडनी का, माइल्ड फैटी लिवर सबको मिलेगा, 90% ऑफ पीपल, एंड सीकेडी की स्टेज 1 सबकी मिलेगी, because GFR nowadays I'm finding it is falling into 90 to 120 wala range only, which is the CKD one, right? And this is what the manifestation of the लाइफस्टाइल वी आर लिविंग, एंड वी नो जो लाइफस्टाइल हम जी रहे हैं उसकी वजह से मेजर इम्पैक्ट किस पे आता है, इंसुलिन की सेंसिटिविटी पे. सो दैट्स हाउ इनडायरेक्टली यहाँ से भी एक रिलेशन एस्टेब्लिश हो रहा है, दैट हाउ इंसुलिन सेंसिटिविटी इज कॉजिंग हार्म टू ऑल these organs, right? Now let's get back on to our insulin sensitivity and your CKD. CKD is a gradual decrease into kidneys functioning, and it is having 5 stages. So let's first talk about the chronic kidney disease, or sometimes it is also named as chronic renal disease, CRD or CKD, whatever you find it, right? So even some of the doctors are calling this KFT as RFT, renal function test, right? So this is how renal word is there for the kidney one. Now what's happening is, on an like if a kidney is healthy, then it is actually filtering 120 ml blood per minute. Totally healthy kidney is filtering this much amount of blood per minute, right? Or like 120 or above. So on an average in a day, your body is, am I audible? Okay. So technically, this your body is filtering around 180 liter blood in 24 hours, right? And this is how kidneys are working efficiently and very you can say very hard working. That your body's total blood is being filtered, and you are in a check key, like you are being in a checkpoint of having the oxygenated blood and the pure blood throughout its day routine, right? Now what's happening is, when your kidneys ability is being a less efficient because of any xyz reasons, major reasons are which is affecting your kidney uh, are your type of drugs and medicines, or you can say alcohol and smoke and all those things you are having. On above of all that is the insulin resistance is also one of the reason now. So when the filtration rate is decreased by 30 units, that means 90 to 120 ml per minute, it is the kidney stage 1, right? Then furthermore, if it is decreased by more 30 units, that means 60 to 89 ml per minute, it is the CKD 2, that is chronic kidney disease stage 2. Furthermore, its reduction to next 30 units. But this 30 units is the alarming one. So I whatever whosoever has asked this question, the CK like filtration rate is 70 to 80. It is coming into CKD 2 only. So that's a normal thing for that age group. because उस age group में already organs are having the oxidative stress, and it is a normal thing. But what's happening is, in case of CKD3, this is the alarming stage, like when the filtration rate is 30 to 59 ml per minute. So that's why इसको two parts में divide कर दिया गया है. So CKD3A and CKD3B stages are there. CKD3A is the stage where the initial fall is there in GFR, that is 45 to 59 ml per minute, right? That means you need to cut down onto your habits, you need to cut down onto some of your food items, right? So that's how you have to deal with it. The more alarming situation is when it is CKD3B, that means 30 to 44 ml per minute ka filtration rate ho gaya hai, right? So this is how it is affecting. After that, अब 15 ml का reduce आना शुरू हो जाता है in your kidney filtration rate, right? Now CKD4 will be the condition when the filtration rate remains 15 to 29 ml per minute, right? And after that, CKD5, which we call end stage renal disease, is something 5 to 14 ml per minute. 10 units का ही हो गया है अब. Like initially 30, then 15, now 10, and 5 or below is the kidney failure or the kidney transplant condition. So this is how these grades are happening, right? So till yet अभी तक हमने देखा है कि जितनी भी problems cause हो रही हैं because of insulin resistance are because giving unnecessary stress to your kidneys. Either it is fat accumulation or the increase in BP or the calcium or the reabsorption is increased of the other nutrients. Now how sugar is playing this role so much as a result of insulin resistance. Insulin resistance hone pe your body tries to maintain the sugar in various other forms, and somehow whenever in your blood the sugar is 200 and above, it is the case that it will be like जब आपकी बॉडी हर एक मैकेनिज्म ट्राई कर चुकी है इसको कंट्रोल करने का, still it will be 160 to 180 milli mm per this mg per dl, right? Milligrams per deciliter. So जब इतनी अमाउंट की शुगर is reaching to your kidney, and kidneys का threshold ही है 160 and above, so 160 mg per dl की अमाउंट में शुगर पहुंचती है आपके किडनी सेल्स के पास, then it starts accumulating over there as well, and it is unable to be filtered, right? क्योंकि sugar generally not to be leaked out into the urine, because sugar is required by your body for the एनर्जी पर्पस. सो जितनी भी शुगर आपकी नेफ्रॉन्स के पास में आती है, इट इज बीन टेकन अप अगेन बाय योर ब्लड टू manage the energy requirements. But in case of hyperglycemia, ब्लड ने वापस भी ले लिया, स्टिल किडनी इज अनेबल टू मेंटेन दैट पर्टिकुलर कनेक्शन एंड द लिंक, इट विल लीक दैट शुगर इनटू द यूरिन. अब यूरिन में वो शुगर लीक हुई है, इट विल गो टू द यूरिनरी ट्रैक्ट, so it is going to cause the UTI problems because the microbes over there, because jitni bhi whatever the openings are there for your body, they are lined by some specialized cells and some sort of bacterias, right, which are actually helping to maintain the pH over there and to maintain the entry of the other harmful bacterias into your system. Now those bacteria will start feeding onto that glucose which is reaching as a result of insulin resistance towards the urinary tract, and as a result वहां पे microbial activity बढ़ जाएगी, normal से ज्यादा हो जाएगी, and it is then going to cause itching or fungal infection and sort of skin issues related to the private part, right? And that's how the problem is again linked with this insulin resistance only. And as a result, जो constant sugar आता जा रहा है, UTI तो हो ही रहा है, along with that your nephrons are being inflamed so much that inflammation in the nephrons is damaging the filtration part, इनिशियली जब आपका डैमेज टू द नेफ्रॉन्स इज सो मच कि वो आपकी जीएफआर को 30 यूनिट से डिक्रीज करेगा, then again 30, then 15, 15, 15, and then 10. And this is how on a certain point it is going to affect your kidneys functioning, and kidney failure might be there. So this is how insulin resistance, as a result of hyperglycemia, as a result of hyperlipidemia, as a result of hypertension, right, is affecting your kidneys so bad. Also, to test onto your hyperglycemic levels and level of diabetes and all that stuff. Yeah, and this is the particular condition which is known as DKD, diabetic kidney disease. CKD is a general case scenario when insulin resistance is only there, right? And when insulin resistance has led into a stage of diabetes, then it becomes the diabetic kidney disease, right? So both these conditions, either it is CKD or it is DKD, is actually been started by your insulin resistance itself. In DKD, the condition you can actually be able to manage by simply managing your blood sugar. But in CKD, you need to cut down on various other things as well, right? Okay, who's this? Will there be any symptom before going to CKD? Yeah, there will be symptoms, so many symptoms. You will feel like very fatigued, tired, bone mineral density थोड़ी सी decrease हो जाएगी. You will find the pain in your muscles, pain in your bones, right? Apart from this, urine का color change होना शुरू हो जाएगा. Your hunger and appetite will be disbalanced. किडनी एंड लिवर इश्यूज के साथ में आ जाते हैं आपके स्किन इश्यूज. सो इचिंग एंड एनी सॉर्ट ऑफ थिंग्स विल स्टार्ट, राइट? ब्लड प्रेशर फ्लक्चुएशन होना शुरू हो जाएगा, वाटर रिटेंशन शुरू हो जाएगी. सो दीज आर द अर्ली साइंस of a kidney damage. That's how every time when you are moving to a doctor, they are simply asking you to three tests: CBC, LFT, KFT, because any normal symptom is actually telling you that any of your this system, like blood wala system or liver system or kidney system, has been damaged or hampered. So we need to diagnose on to what condition has arisen, right? Also anemia might be there, right? Vitamin D deficiency will be there, right? So this is how the symptoms of all these problems are these only. So whenever you feel like all these things, that's how you have to go for a test. That's why it has been advised कि अगर आप totally healthy हैं तो yearly checkup कराते रहो, so that you will be keeping a check on to your problems, right? If any sort of genetical or hereditary issues are there, then you need to focus on to your health a bit more. You need to make your lifestyle changes a bit more healthy, right? So that's how you have to keep on checking, right? Okay, so what I was telling just before this question.
Ma'am, CVD and DKD.
CKD and DKD. Yeah. So this is how DKD is there and CKD is there. And apart from this, how the kidney failure is been caused by your normal this kidney functioning. नॉर्मल जो किडनी फेलियर है, इट इज एक्चुअली अ मैनिफेस्टेशन एज अ रिजल्ट ऑफ इंसुलिन रेजिस्टेंस व्हेन सो मच ऑफ सोडियम इज देयर इन द ब्लड व्हिच इज रीचिंग टू योर किडनीज दैट किडनीज आर अनेबल टू टॉलरेट दैट, एंड दैट इज द केस ऑफ योर insulin resistance only. The study on this area is still going on. Not a very direct link is established, but whatever the researches were there and whatever the participants were there, it has been found जिनको insulin resistance था उनका kidney failure के chances were more higher, and even they had more you can say, like it has been evident as well कि kidney failure उन्हीं लोगों में पाया गया जिनको insulin resistance काफी लंबे समय से चल रहा था. The major problem with insulin resistance is there that we are just focusing on insulin when your sugar starting getting increased, blood sugar, right? So it's better to check on to any other test, like it's better to check on to your insulin levels than to check on to other levels of your body, right? क्योंकि आपके जो इंसुलिन का लेवल है अगर वो आपको पहले पता चल जाएगा तो बाकी की जितनी भी प्रॉब्लम्स आर स्टार्टिंग बिकॉज ऑफ द इंसुलिन रेजिस्टेंस, दे विल बी डिक्रीज्ड, they will not be there anymore, and you will be having like very less chances of having any sort of other diseases. So it's very mandatory to go on to insulin level checking after every 6 months. It's a bit costly test, but yes, then it is actually very important, right? So hyperglycemia and hyperlipidemia are the major reasons. Till date we have find that kidney failure जो होता है in insulin resistant people, but still researches are going on. We can have much more data whenever the researches are completed, because होता क्या है जो भी हमारे such types of researches are being done, it's not like कि हम किसी को इंसुलिन की एक्सेस देंगे फिर उनको उस कंडीशन में डालेंगे, because it's non ethical. So जितने पेशेंट्स अवेलेबल होते हैं ऑलरेडी विद दोज कंडीशंस एंड उनको जो ट्रीटमेंट दिया जा रहा है, दिस इज व्हाट वी कॉल द क्लिनिकल रिसर्चेस, जहां पे आपके पास कंडीशन ऑलरेडी है, आप जस्ट उसको स्टडी करते जा रहे हो, मॉनिटर करते जा रहे हो। दैट्स हाउ दीज रिसर्चेस आर डन। ऐसे नहीं होता है कि जैसे आपको एक्सपेरिमेंट करना है, आप पहले एक कंडीशन बनाओगे फिर उसमें चीजें ऐड करोगे, देन इट इज द वे। नो, बिकॉज इट्स द ह्यूमन बेस्ड स्टडी ना, तो इट इज नॉन एथिकल इफ यू आर लाइक प्लेइंग विद द लाइफ, राइट? सो दैट्स हाउ ऐसे रिसर्चेस लंबा टाइम भी लेती हैं, रिजल्ट भी लेट लेट आते हैं। लाइक रिसर्च जस्ट लाइक इफ आई विल टेक this particular research which has been started 30 years ago, PCOS and tai chi yoga, right, which is a Chinese yoga. So it is been found very good for the PCOS females to have to do Tai Chi yoga every day. It is increasing into insulin sensitivity. But still, this research is going on, and whatever the result has been established till yet from this research, it has been found, right? 50 to 60 females like उनके अलग अलग batches लिए जा रहे हैं। 50 साल की ये रिसर्च है जो कि चल रही है, and 35 years I guess has been done already. So see, 50 years के बाद you will get one result of it. So till that, in those 50 years, it's just a normal human span nowadays, obviously. So this is how we need to be. No, we should not wait for the results to come. Rather, whatever the information you have, just try to focus on to increasing your health, right? So that's what the major thing I would actually like to say. Now coming on to this dietary part related to the insulin and your kidney disease and all that stuff is, like till date we have like whatever the discussion we had done, we it's been evident कि insulin resistance आपकी kidneys को hamper तो कर ही रहा है, and it will become the life threatening condition अगर it is been the last stage. So to check on to your insulin wala damage on kidney, what particular tests you can go on? It is the urine protein to creat ratio, PCR, urine albumin to creat ratio, UACR. It is your lipid, you can say this lipid, urine lipid profile. Yeah. Apart from this, your blood sugar sorry, urine sugar, glucose in the sugar. Apart from this, your insulin fasting and PP, and your urine pH. These are the general tests which you can go for to test onto whether the effects are because of your insulin resistance onto your kidney health, है ना? किडनी जनरली शुगर पेशेंट्स में आप देखोगे डॉक्टर्स आर प्रिस्क्राइबिंग दिस UACR टेस्ट, चाहे उनका HbA1c नॉर्मल आ रहा है, यू विल फाइंड दिस HbA1c काफी टाइम नॉर्मल आता है बट UACR इज वेरी हाई, राइट? सो दैट इज हाउ इट इज टेलिंग कि आपकी शुगर ने किडनी को डैमेज कर दिया है। एंड नाउ चाहे आपका HbA1c कितना ही नॉर्मल है, you have to focus on to your insulin sensitivity so much, you have to focus on to your restriction so much, and you have to keep taking the particular drugs or particular therapy for the diabetes management. Only then your kidneys will be able to sustain, right? And sadly we know कि kidney damage is irreversible after a certain point. अगर kidney damage आपका 44 वाली स्टेज पे पहुंच जाता है, CKD3B, it is irreversible, it cannot be re-established. So till CKD3A, your body is actually having its particular ability to still reverse it, but after that stage no reversible is there. It's totally irreversible, and eventually you can maintain the kidney health at that point only by following a good lifestyle, right? So this is how you have to focus on to. Now coming on to your like we have got to know कि कौन से टेस्ट कराने हैं, किन चीजों को आपको ढंग से देखना है. Now coming on to what type of diet you should follow, right? So for kidney patients, it is actually been advised so much to focus on to their macros and micros so deeply. Let's start with the macros. In kidney patients, we should actually give not so simple type of carbohydrates. It should be a bit complex, or you can say fiber rich diet, right? Apart from this, it should be whole grains, unprocessed, non refined, right? So this is how, sorry.
Giving complex carbohydrates may burden the liver or kidney to.
See, at this point, I'm talking specially about kidney, right? To maintain your kidneys healthy. It's not the case जब आपकी kidneys पूरी तरीके से damage हो चुकी है and now you are starting on to. उस time पे तो obviously you need to focus on very different sort of things, which is obviously we cannot discuss in this particular webinar here itself, right? So, but then to manage your kidneys health, even before it start degrading, or you can say if it is a stage, just like any one of you has asked this question ki 70-80 पहुंच गई है GFR और age इतना है, so उस age पे I'm talking about this, क्योंकि insulin sensitivity will be increased by these only, right? And apart from this, your body's mechanism of fat accumulation will also be decreased by this type of diet, this type of carbohydrate itself, right? So carbohydrates and fiber intake should be there. Carbohydrate, if I'm talking, it is actually the complex one, right? It is actually the whole grains one, right? So this is how this particular macronutrient to be taken in this form. Protein and fat quality. Fat should be essential fatty acid, POFA, MOFA rich. Saturated fat should be cut down, not completely, but yes, to maximum of it. Apart from this, protein, it should be plant based protein, not of animal based protein so much, because anyway that has been taught to you people that how plant animal based protein is actually increasing into the acidic environment, right, in the biochemistry which we are studying in the internship always, right? So this is how it is actually been impacted the major burden on your kidneys only, right? So plant based protein should be taken. Apart from this, related to hydration, stay hydrated, drink plenty of water. It's not like plenty means sub, it's relational, right? It's relative. आपकी बॉडी में हाइड्रेशन का मतलब, प्लेंटी हाइड्रेशन का मतलब ये नहीं है कि सबको ही 4 लीटर पीना है या 8 लीटर पीना है या 3 लीटर पीना है. नो, try to read on to the signs and signals your body is giving. Try to observe your activity level. If you are a corporate person, you are sitting in the AC 9 to 10 hours, right, and you don't have much of the activity level, then it's 1.5 liter is also okay, right? Apart from this, if someone is from the labor class, if they are having so much of the problem, like so much of the day outside in sweating and all that stuff, they should have 3 to 4 liters. If someone is athlete training so much onto their body, then they should even drink 8 liters of water, right? So that's how it's relative. The plenty word is relative. That's why I have not mentioned any amount of the water related here. But yes, be hydrated. Keep yourself hydrated to maintain the electrolyte balance, right? Apart from this, specific nutrients, omega 3 is very important because it is having antioxidant activity as well. It is having, you can say, this energy utilization activity as well. Also, omega 3 is very important for other, you can say, nutrients absorption. Just like omega 3 is required for vitamin E and selenium, and vitamin E is further required for selenium, and selenium is one of the nutrient which is very important for your insulin and thyroid hormones, right? Okay, who's this? Quantity of protein also in different CKD conditions. Okay, that's actually a bit, you can say, I cannot specify right at this moment for all those things, but yes, in CKD1, CKD2, you can still have protein somewhere around 60 to 65 grams a day, provided on your height and weight. Because obviously, I cannot teach all those aspects of calculating protein for a person, but it's just the average one. For CKD3A, person can have 50 grams protein, right? It's again relative to their body and all that stuff. I cannot explain everything over here, right? After that, CKD3B. At this stage, protein restriction is starting. So 45 to 50 grams is there. Apart from this, now furthermore degrading, the least amount of protein to be given is 30 to 40. That's for the proper, you can say, quality of life. Because इससे कम protein अगर आप दोगे तो at that stage of particular, you can say, condition of kidney disease, body already has that catabolic effect. जहाँ पे लीन बॉडी मास आ चुका होता है, तो उनकी बॉडी को मेंटेन करने के लिए प्रोटीन की रिक्वायरमेंट तो है. सो दैट शुड बी ऑफ गुड क्वालिटी, बट 30 grams to 40 grams only. Just like if the person is having CK like GFR of 30, right? So they should have minimum of like maximum of 30 gram protein, but of the good quality, ताकि उनकी बॉडी का एनाबोलिज्म भी स्टार्ट हो जाए and they can thrive on to that, right? Okay, who's that? Acid base balance is also because of kidney issues. I mean, acidosis. Yes, of course. Acid base balance is majorly the kidneys function only because सारे जो electrolytes होते हैं, your kidney is maintaining by absorbing, reabsorbing, and filtering into the urine. That's how the urine का जो like what we call that composition होता है, वो आपको बताता है कितना अमाउंट ऑफ द न्यूट्रिएंट्स, कितना अमाउंट ऑफ इलेक्ट्रोलाइट्स, कितना अमाउंट ऑफ द these ions are there in the urine, and after that जितनी भी requirement होती है of your blood, it is been retained back. But if kidney is damaged, then urine में वो ज्यादा निकल जाएगा, maybe वो absorb ज्यादा हो जाएगा. So this is how your kidney is actually deciding onto the acidosis and alkalosis condition. And this all these things we are actually studying in the lab report reading part, which is there as a topic of the internship as well, right? So those who had done internship already with me, they must be aware of all these things, जहाँ पे मैं acidosis, alkalosis, report को कैसे पढ़ना है, क्या उसके पीछे phenomena होता है, everything I have taught in the KFT panel, right? Because that's a itself a 1 hour long session, so I cannot like tell here in this half an hour or 20 minutes or 2 hours where मेरे पास already एक बहुत बड़ा topic होता है explain करने के लिए. But kidney parameters are fine, even the GFR. What could be the reason? That means the reasons could be the acidosis is because of the insulin resistance only, and insulin resistance of that grade which has not started affecting the kidneys, right? इंसुलिन रेजिस्टेंस, लाइक आई टोल्ड यू, ये आपके ऑर्गन्स को खराब करता है. अब वो कौन से ऑर्गन को करेगा, दैट इज ऑल्सो रिलेटिव. अगर जेनेटिकली किडनी डिजीजेस वर देयर इन द प्रीवियस जनरेशन और इन योर पेरेंट्स और ग्रैंड पेरेंट्स, देन फर्स्टली किडनी विल बी अफेक्टेड, राइट? इफ सम सॉर्ट ऑफ हार्ट इश्यूज वर देयर कि हार्ट वीक था, तो सबसे पहले हार्ट. और वंस अ डैमेज इज स्टार्टेड इन एनी पर्टिकुलर ऑर्गन, तो पहले वो डैमेज उसी डायरेक्शन में जाएगा. It got its direction to reach to that organ, right? So that's how it's relative. And this acid base balance can also be because of your gut health, can also be because of your normal blood pH disturbance, right? And it could also because of the liver toxicity as well, right? So this is how this can be done, right? After kidney transplantation, protein quantity is normal for the person. Kidney transplantation के बाद आप maximum 45 to 50 grams प्रोटीन, उससे ज्यादा नहीं देना है, बेस्ड ऑन की उसकी हेल्थ कैसी है, बॉडी कैसी है. मिनिमम 40 तो देना ही पड़ेगा टू मेंटेन दैट लेवल, एंड दैट टू नॉट द एनिमल वन, राइट? So try to give more of the plant-based protein to those people, right? After that, okay, specific nutrients I was actually talking about related to this kidney and insulin sensitivity health. Okay, please mute yourselves. Then the vitamin D is one nutrient which has to be focused. Then magnesium is also there, because magnesium is very important for the insulin sensitivity. Magnesium is managing your pancreatic cells to liberate or to secrete, you can say, mannerful insulin amount only. Apart from this, जो insulin non functional हो जाती है, it is when the case जब आपके receptors onto cells are not accepting insulin anymore, and that insulin is sticking onto the endothelium, right? That's how the organs are started getting affected. But magnesium is doing what, like it is actually making those receptors free to accept the insulin. So this is how ये insulin के sensitivity को increase करता है. And vitamin D, obviously it is very important for decreasing the obesity, for maintaining your nervous system, for maintaining your calcium metabolism, and to even make your renin angiotensin system good, which is also a part of the kidney. So this is how, by doing all these things, by decreasing your weight, by maintaining your kidney health, it is somewhere decreasing insulin resistance. Because I told you, insulin resistance and kidney diseases is a bi-directional relation. अगर kidney health सही होना शुरू हो जाएगा, so insulin resistance भी अपने आप में ठीक होना शुरू हो जाएगा. Apart from this, there are some other lifestyle interventions as well, which we have to follow if we want to make our insulin sensitive more. Like, first of all, every day 15 minutes of minimum workout is required, right? And apart from this, every day 15 minutes of जो वर्कआउट है वो आपका नॉर्मल पेस होना चाहिए. 15 मिनट्स वर्कआउट आपका होना चाहिए हाई पेस का, लाइक सम सॉर्ट ऑफ स्ट्रेंथ ट्रेनिंग, वेट ट्रेनिंग, so that insulin sensitivity will be increased. Then to, like I told कि insulin resistance के other reasons क्या होते हैं? Stress, lack of sleep. So you need to manage onto your stress as well. Stress management के तरीके क्या होते हैं? Meditation, yoga, deep breathing, running, CR activities. So this is how you should do. And apart from this, जो भी आपके some sort of foods, like foods rich in tryptophan, foods rich in your serotonin, right? Foods rich in calcium should be taken, right? Sleep and relaxation is very important. You should take 5 to 7 hours of sleep at night. Not any time of the day, but at night, so that melatonin will be functioning well. And if melatonin is in normal, you can say functioning, then your body's circadian is total normal, and your body will be having total good and total healthy functioning of all the hormones, of all the organs, of all the tissues. Apart from this, if somebody is having smoking or liquor habits, you need to cut down them then and there, because smoking kills so much. स्मोकिंग क्या करता है? सबसे पहले लिवर को डैमेज करता है, प्लस आपकी आर्टरीज को डैमेज करता है. एज अ रिजल्ट ये बॉडी में साइटोकाइन एक्टिविटी बढ़ा देता है. एंड देयर इज अ डायरेक्ट रिलेशन ऑफ साइटोकाइन एंड इंसुलिन, राइट? साइटोकाइंस एंड इंसुलिन के रिसेप्टर्स आर सेम ऑन टू द सेल्स. अगर साइटोकाइंस इंक्रीज हो गई बॉडी में बिकॉज ऑफ द ऑक्सीडेटिव स्ट्रेस, राइट, सो वो क्या करेंगे? दे विल स्टिक ऑन टू द रिसेप्टर्स वेयर इंसुलिन हैज टू अटैच. नाउ अब इंसुलिन अगेन फ्रीली घूम रही होगी, राइट? सो दिस इज हाउ यू मस्ट हैव फाइंड. फीवर के टाइम पे आपको जनरली कुछ फ्राइड खाने का मन कर रहा होता है, या फिर कुछ शुगर मीठा खाने का मन कर रहा होता है. व्हाई दिस इज हैपनिंग? बिकॉज फीवर के टाइम पे इन्फ्लामेशन है ना, साइटोकाइन एक्टिविटीज बढ़ी हुई है ना, सम सॉर्ट ऑफ ऑल द इन्फ्लेमेटरी मार्कर्स आर इंक्रीज. वो क्या करते हैं? इंसुलिन की सेंसिटिविटी को थोड़ा डिक्रीज कर देते हैं, जिसकी वजह से यू फील लाइक क्रेविंग फॉर दोज, है ना, पेस्ट्री, चॉकलेट्स, ब्रेड्स, केक्स, ये सब खाने का बहुत ज्यादा मन करता है ड्यूरिंग द फीवर एंड एनी सॉर्ट ऑफ इन्फेक्शियस कंडीशन. बिकॉज ऑफ दिस फैक्ट ओनली कि आपकी बॉडी उस टाइम पे इंसुलिन रेजिस्टेंट है एंड एक्चुअली wanting to have like having all those cravings, right? Apart from this, you actually need to focus on to some sort of supplements as well, which is myoinositol, chromium, if in case diet is not able to provide you. Because for the vegetarian people, generally chromium is not that easy to be taken up by the diet only, because major sources of chromium are the non-vegetarian part, right? So this is how some sort of supplementation is also been required to maintain your insulin sensitivity. So these changes are actually for the insulin sensitivity. Now, what about the kidney health or changes related to the terms of diet and all that stuff? You need to first cut down onto your sugar and salt so much, right? Only 2500 milligrams of salt or sodium is okay for a patient with CKD3B or CKD3, right? Apart from this, sugar needs to be cut down, because anyway sugar is increasing onto all these things and creating a pressure onto your kidneys to filter it out. Then omega 3 is very important for kidney patients as well, to prevent the damage onto the nephrons, right? अगर CKD3 A stage है तो it is reversible, so omega 3 will start healing the nephrons by decreasing the oxidative stress over there, right? And then hydration, so that osmotic balance bana rahe, osmolarity is maintained, right? Apart from this, anti nutrients को आपको reduce करना in diet. So for that matter, you need to soak foods and ferment foods, right? So this is how kidney health will be maintained. And also related to this kidney, you need to avoid all the preservatives, additives in the food. You actually have to stop eating the processed food. You actually have to even the natural foods which are high in the pigments, which are high in the aromas and flavors, just like beets, just like raw onion, right? So that's how you need to avoid onto these as well. And along with that, some sort of lifestyle changes, like you need to stop using the deodorants, you need to stop using the any sort of aroma wale products which are generally used nowadays very frequently and very openly by people, right? Also, you need to cut down onto fried food for the trans fat intake into the body, right? क्योंकि आपकी बॉडी नेचुरली ट्रांस फैट बना रही होती है, right? So you need to focus on to these. Along with that, do some sort of yoga techniques for sure to increase into oxygen intake, right? And to maintain your brain, ताकि sympathetic nervous system ज़्यादा activate ना हो, stress maintained रहे, and as a result adrenal gland will be at rest and less of the stressful hormone secretion will be happening, right? Also stop checking the habit of like stop checking the weight वाली habit so much, कि आप बार बार चेक कर रहे हो, उससे भी स्ट्रेस अननेसेसरी का बढ़ता है, जिससे आपकी प्रॉब्लम क्या शुरू हो जाती है? Again, the stressful environment and adrenal gland activation and all those hormones and the cascade of the events is starting, right? So this is how all you need to change in your these habits to have a healthy kidney, right? So this is just a miniature of kidney diseases. It's not like in-depth explanation or in-depth knowledge about the kidney diseases, but it's just an aspect related to the insulin resistance, and that too on very, you can say, outer we can say type scope of the knowledge, कि आपको पता होना चाहिए कि किस डायरेक्शन में things are leading into if you have any sort of insulin resistance. क्योंकि इंसुलिन रेजिस्टेंस का टेस्ट हम कराते नहीं है, एंड वी आर नॉट गेटिंग टू नो until द टाइम जब डायबिटीज की मैनिफेस्टेशन आ चुकी होती है, पीसीओएस की मैनिफेस्टेशन आ चुकी होती है, ओबेसिटी, कैंथोसिस निगरिकन्स, इनकी manifestations are there in the body. Till that time insulin resistance is so much कि अब किडनीज पक्का पक्का CKD4 या CKD3 की स्टेज में मिलेगा, right? And even the parathyroid glands are so you can say affected, right? So this is how you need to focus on to all these things. So this is all for the topic, and if you people have any questions, I'm open for the questions here for the 10-20 minutes.
Ma'am, what is the effect of blood thinners if they are given in more quantity? As one of the known person is taking 10 mg of Rivaben. So what will be the effect on kidney?
Blood thinners are actually causing योर ब्लड सो लाइक ब्लड थिनर्स के साथ में ना क्या होता है, आपका जो पोटेशियम का मैकेनिज्म है, आपका जो विटामिन डी का मैकेनिज्म है, दे आर बीन अफेक्टेड, राइट? एंड ऑन योर किडनीज इट्स नॉट द डायरेक्ट इफेक्ट और द इंस्टेंट इफेक्ट, बट अगर लॉन्ग रन में इट हैज बीन टेकन, देन
Yes, ma'am. He has been since last 4 years, and recently we have got vitamin D and vitamin B12 checked. It is just on margin. Vitamin D is very low, 25 है.
या सो बेसिकली व्हाट्स हैपनिंग, क्योंकि आपकी ना किडनी का पूरा डैमेज होना शुरू हो जाता है। ब्लड थिनर्स पहली चीज, दे आर द नॉन स्टेरॉइडल एंटी इंफ्लेमेटरी ड्रग्स एंड NSAIDs आर आल्सो causing so much of the problems onto kidneys itself for the clearance itself, ठीक है? स्टेरॉइडल ड्रग्स जो होते हैं वो तो बॉडी वैसे ही एब्जॉर्ब कर लेती है एंड causing some sort of steroidal changes, but non steroidal ones are actually being cleared off by the kidney। तो पहली चीज वो वहां पे बहुत ज्यादा प्रॉब्लम डालता है। दूसरी चीज आपकी ना एंटी कोएगुलेंट रिलेटेड न्यूरोपैथी स्टार्ट हो जाती है। एंटी कोएगुलेंट न्यूरोपैथी जो होती है, इसमें क्या होता है, आपकी जो नेफ्रॉन्स हैं उनकी वॉल्स अगेन स्टार्टिंग डैमेजिंग बिकॉज ऑफ द sticking of that particular drug over there, right? And kidney damage will start, but it is not an overnight, not an instant kind of thing. Over the period of time, if people are taking, then again a more stressful condition will start and all these vitamin related deficiencies will be happening। so that's how these blood thinners are actually not to be taken so much, and otherwise even in the urine also they will be coming into the traces and some sort of abnormal, that just like for that matter we are doing the urine culture testings ki जो भी constituent, जो भी चीजें are there in the urine, they can be identified, and then
And
ultimately
is there any diet precaution which can be taken for to suppress these factors?
yeah, antioxidant rich diet is very important।
Okay, ma'am.
Yeah,
Okay.
because to prevent the damage to the cells of the kidneys।
Okay.
see, होता क्या है, आप जो भी खाते हो ना, whatever you are eating, it is causing some sort of like creating some sort of oxidants in your body,
Oxidative stress.
and those oxidants are not very natural and are not very favorable and familiar by your cells। तो वो क्या करते हैं, oxidants जो होते हैं बहुत ही reactive होते हैं, they will start finding their place to stick on to stay on to any one place, right? But
Yeah.
in that sense you need to stop their activity, and against them some sort of ingredients or nutrients are to be taken, which we call antioxidants, right?
Yes.
So
Okay.
antioxidant rich diet, just like the selenium, magnesium, zinc can be
Okay.
taken। Yeah, omega 3, which I already told, it's very important, right? एंड इवन ब्लड थिनर्स इतना ज्यादा थिन कर देते हैं ब्लड को कि उसकी एक विस्कोसिटी भी चली जाती है जो पर्टिकुलर होनी चाहिए। सो
Yes,
दैट
ma'am.
लेस विस्कस ब्लड विल बी, क्योंकि आपकी जो किडनी में एब्जॉर्प्शन रीएब्जॉर्प्शन होता है ना, इट इज ऑल्सो बिकॉज ऑन द बेसिस ऑफ ग्रेविटी एज वेल। आपने देखा होगा
Okay.
यूरिन में
Yes,
ग्रेविटी
ma'am.
वाला भी एक फैक्टर होता है।
Yes, ma'am.
तो अब क्या होगा, वो विस्कोसिटी इतनी कम हो गई है, वो स्पेसिफिक ग्रेविटी इज बीन increased, and urine will also start coming into, sorry, blood is also start coming into urine, which we
Yes,
call
ma'am.
hematuria।
Yes, ma'am.
It is also because of the damaged nephrons, it is also because of the less viscosity।
Yes, ma'am. Traces of blood cells means are seen in the urine also.
Yeah, so that's how you need to focus on to all these। so
Okay.
yeah, किडनी के लिए अदर नॉर्मल फिजिकल पैरामीटर्स विच यू कैन चेक ऑन टू, जस्ट लाइक आई टोल्ड यू कि एफोसेंस वाला यूरिन है ना, झाग झाग जैसा सा यूरिन दिखता है, वाइट वाइट कलर का। और अपार्ट फ्रॉम दिस, इफ यू फाइंड एनी ट्रेसेस और रेडिश ब्राउन कलर यूरिन है, राइट? इफ यू फाइंड एनी सॉर्ट ऑफ येलो यूरिन, राइट? so urine analysis is
Ma'am,
itself
2 to
telling,
abhi recently we have done the urine test. So 2 to 4 RBCs are seen in that urine culture.
that's a general case scenario।
For males also?
या 2 to 4 यूरिन में ब्लड सेल्स और पस सेल्स आज की डेट में बहुत काइंड ऑफ नेचुरल और नॉर्मल केस
I
सिनेरियो है,
thought
because
कि for male it is uncommon because ladies में तो there might be some other
no
reason.
no it's not because of menstruation and all, that's a different story, right?
Okay, okay,
so
ma'am. Thank you.
that's
Or ma'am, how can we connect you after the seminar? provide
Are
some
you
number.
there in any of the group?
No, ma'am, I'm not. Yes, ma'am. The information I got through that group. I am
Which,
there in the group, but I
which
want to connect you afterwards.
Okay, Chaya, please write my number over there in the text so that people want to connect, they can connect me later on after the
Okay,
session.
ma'am. Thank you so much.
Yeah.
मैम आई
So,
हैव अ क्वेश्चन
yeah, who's this? Please.
मैम
Name.
मैम एक्चुअली जैसे आपने बताया कि ब्लड थिनर हमको कंटिन्यूअसली लेना नहीं चाहिए लगातार तो मैम ये जैसे ब्रेन में क्लॉटिंग आ जाती है किसी पेशेंट को तो मैम डॉक्टर तो उसको प्रिस्क्राइब करते ही है कि भी आपको ये लेना ही है फॉर लाइफ टाइम लेना है फिर हम उसको कैसे नेग्लेक्ट कर सकते हैं
See, there are some situations or conditions जहाँ पे आपको like support लेना पड़ेगा अदर चीजों का, चाहे वो सम सॉर्ट ऑफ ड्रग्स हो, सम सॉर्ट ऑफ मेडिसिन हो, सम सॉर्ट ऑफ सप्लीमेंट्स हो, तो वो लेना पड़ेगा। लेकिन उसके साथ में देयर आर थिंग्स यू कैन चेंज बाय डाइट, क्योंकि डॉक्टर्स आपको डाइट तो बताएंगे नहीं, डॉक्टर्स तो आपको दवाइयां ही बताएंगे, बट इट इज योर ड्यूटी एज वेल, यू कैन ऑल्सो मेक देयर ब्लड इनटू नॉर्मल कंडीशन। जो ब्लड में आपकी बहुत ज्यादा थिकनिंग हो रही है, विस्कोसिटी बढ़ रही है, उसको कम करने के लिए आप क्या करोगे? मूफा डालोगे डाइट में, है ना? कोलेस्ट्रॉल वाली डाइट थोड़ा कम करोगे, एक्टिविटी लेवल थोड़ा सा बढ़ा दोगे, राइट? एंड एंटीऑक्सीडेंट्स बढ़ा दोगे, इंसुलिन की सेंसिटिविटी इंक्रीज करोगे। सो एनीवे एक दिन में तो चेंज नहीं आएगा, but yes, you will find these changes after 3 4 5 6 months, है ना? और एकदम से आप किसी की दवाइयां बंद भी नहीं करा सकते हो, दैट इज ऑल्सो वन थिंग विद डाइट, क्योंकि डाइट से ही चीजें खराब हुई थी, हमें पता है। वो भी एकदम नहीं हुई थी, बहुत लंबे
Ma'am,
टाइम
in
के
that
बाद।
case, his thinners can't be stopped because he is having that pulmonary embolism sometime 4 years back.
या
So because of varicose veins, so he should be capped on the thinner 10 mg as per the requirement. So I just wanted to know about that diet में क्या changes we can do so that the effect will be minimized or sort of discarded. So that is
दैट्स
why
व्हाट
I
आई एम
want to.
टेलिंग, या दैट्स व्हाट आई एम टेलिंग ना, उनको मूफा रिच
हाँ,
डाइट दोगे आप, ठीक है?
yes, ma'am.
ऑलिव, फ्लेक्स सीड्स, वॉलनट्स, राइट? अपार्ट फ्रॉम दिस आप उनको बहुत कम सैचुरेटेड फैट दोगे, फाइबर रिच डाइट दोगे, सोल्यूबल फाइबर वाली डाइट दोगे, पैक्टिन्स बढ़ाओगे, गम्स बढ़ाओगे, ठीक है, जो कि आपके कोलेस्ट्रॉल को बाइंड करते हैं, ठीक है? ऑल्सो थोड़ा सा एक्टिविटी लेवल सही रखोगे, बट एम्बोलिज्म
Ma'am,
की आप स्ट्रेनथ
activity
नहीं कर
level is
सकते।
okay, or cholesterol and everything, that profile is perfectly fine. There is only one issue related to he is coming to pre-diabetic. This time the
आएंगे, पक्का आएंगे।
HbA1c is coming, 6.1 has come.
हाँ, क्योंकि इंसुलिन सेंसिटिविटी भी कम होती है ब्लड थिनर से।
Yes, ma'am. That is the only issue. And the second issue was that RBC in the urine. Otherwise, the things are manageable till now. So I
Just
thought what precautions can be taken in further future now, so that the effect
better
will be.
than all these things, you can simply add on to multivitamins as well to generally maintain all the levels of, and B6 and B12 is highly
Yes, ma'am.
required। हिस्टीडीन का जो आपका चल रहा होता है ना, पूरा का
Okay.
पूरा साइकिल इज बी।
Homocysteine and dimer is okay, ma'am.
Okay, that's okay, but
Yes.
generally these tests are done on the blood concentration, ठीक है?
Yes,
ब्लड के भी
ma'am.
टेस्ट होते हैं, प्लाज्मा एंड सीरम लेवल के। सीरम
Yes,
लेवल में
ma'am.
कितना है, यू नीड टू फोकस। अपार्ट फ्रॉम दिस उनके स्टोर्स भी होते हैं, तो आपको वो
Okay.
स्टोर्स भी चेक कराने होते हैं। ब्लड में तो हो,
Okay.
क्योंकि योर बॉडी, सी ब्लड इज द कनेक्टिव टिश्यू, अब ब्लड को सारे ऑर्गन्स तक लेके जाना है ना? तो ब्लड के अंदर किसी भी न्यूट्रिएंट की डेफिशिएंसी बॉडी नहीं होने देती। रीजन
Yes.
बीइंग इट हैज टू गिव टू ऑल योर सेल्स एंड टिश्यूज। तो ब्लड में आपके जितने भी पैरामीटर्स मिल रहे हैं, दे आर रिलेटिव इन टर्म्स ऑफ योर स्टोर्स, तो आपको स्टोर्स चेक करने चाहिए।
Ma'am, I just want to know कि the diet supplementation is sufficient, or we need to supplement otherwise also apart from
Surely
diet?
I cannot tell this
No,
answer
I'll
right here.
connect
I
you.
need
That
to,
is what.
yeah, I need to
Okay,
see
ma'am.
the
Thank
reports,
you.
I need to see all
Yeah,
the
yeah,
things,
sure,
yeah,
ma'am. Okay, I'll
because
connect you later
this is
on.
what
But
the customization thing is known
okay,
as,
okay.
and this is how we need to actually like it's a
No, no,
medical
ma'am. You
profession.
have given a lot of information apart
Yeah.
from, matlab, as you are conducting that free webinar, still you have provided a lot of information. So that is why I asked for the number so that I can connect you later.
Yeah,
Okay,
surely.
thank you so much, ma'am.
Yeah. Okay, so This is all about today's webinar. If in case you people have any questions, do ask me. Apart from this, there is one announcement is there. Like from Monday, we are starting on to our new internship batch. All these things, all these lab report reading things, and whatever the general case things for the professionals or the students of nutrition and dietetics is there, will be there in the internship program. So those who actually want to learn more, who actually want to increase onto their practical exposure and practice and understanding to these topics which are generally not taught in any sort of you can say courses or any university or any institute, which I am here at Potion Pushpa providing you all, so you can connect me for that as well. And still, if you have any questions, you can ask me. But related to the internship, it is starting like from Monday itself. There is no any postpone or any sort of change in the dates are there. So you can go
Ma'am,
for
can
that as
you
well.
let us know about the fee structure of yours?
Everything is there. Like it is related to what?
That is given in the group.
Yeah, I don't know which group you are in, so I
Ma'am,
don't
is this
know.
Poshan Pushpa only? The
Potion,
Pushpahar.
Pushpa. Okay, I
Ah,
have all the name groups named with this.
okay.
So which is there? It is the dietary tips wala group or it is what group?
No, ma'am, it is not the dietary tip. It internship group. It is there. Internship
Batch.
information for in.
Batch.
Yeah. Batch information is there in the group,
Ma'am,
but I was not aware of that till
Okay.
now.
Yes.
can we leave, ma'am?
Yeah, those
Ma'am,
who
do we
want
have
to
class tomorrow?
Thank you so much, ma'am.
will update
It
in
was
group
nice
itself.
session.
Opa.
Okay, thank you, ma'am.
Okay,
Thank you.
Yeah.
sir. Thank
Yeah.
you,
Thank you,
ma'am. I'll
ma'am.
take information in the group.
Yeah, sure.
Okay. Thank you so
All
much.
right.
मैम अगर जैसे कहते हैं कि ब्लड थिनर जैसे इकोस्प्रिन की गोली होगी तो उसके साथ आप अगर चिया सीड वगैरह देते हैं तो उसके अंदर सही नहीं है, आप कोई एक ही चीज दे सकते हैं, तो मैम ये कहाँ तक सही है?
See, chia seeds and all those stuff जिनका already थोड़ा effect होता है on to lowering your blood thickening effects. So that's how वो ज्यादा ना कर दे, क्योंकि अगर blood thin बहुत ज्यादा हो गया तो it will increase the blood pressure as well. And sudden brain stroke can be there. So that's how it has
तो
been
मैम
said
यही
कि
तो मैं कह रही हूँ कि जैसे कि
आपकी
आपने
जो
बोला
डोज होती है
कि
ना ब्लड थिनर की,
हम्म
बेस्ड ऑन दैट, एंड ब्लड थिनर्स में भी ना आपके पास एडवांस्ड एज के ब्लड थिनर्स हैं, एक पुराने वाले हैं, है ना, जो कि हम जिसको बोलते हैं क्लासिकल एंड द एडवांस्ड वाले. सो अगर क्लासिकल वाला ले रहे हो उसके साथ में अदर sort of guidelines are there. एडवांस्ड वाला ले रहे हो, they are themselves so much efficient कि वो आपकी सारी प्रॉब्लम्स खुद ही सोल्व कर देंगे. So as per that आपको फिर डाइट में चेंजेस करने होते हैं. Then obviously chia seeds and all that stuff needs to be cut down into the diet, not to be taken so much, because anyway it will brain stroke होने के बहुत ज्यादा chances रहेंगे.
मैम आप ये कह रहे हैं ना जैसे कि अगर चल रहे हैं साथ में ब्लड थिनर चल रहा है तो उसके साथ आप डाइट दो, तो फिर हम डाइट देंगे तो मैम फिर ब्लड तो ज्यादा
नहीं,
फिर पतला हो जाएगा.
that what I'm saying कि आप दवाई को ना एकदम से रेस्ट्रिक्ट नहीं कर सकते, बंद नहीं कर सकते, डोजेस कम करा सकते हो ना, है ना. आप पहले डोज देखोगे कितनी डोज चल रही है, फिर साथ में आप डाइटरी चेंजेस करोगे, फिर उनके जो नेक्स्ट पैरामीटर्स होंगे, जो भी चेकअप्स होंगे, बेस्ड ऑन दैट द डॉक्टर कैन एडवाइज ऑन टू द डोज कट डाउन, राइट. जस्ट सिंपली लाइक जैसे आप शुगर किसी का मेंटेन करना शुरू करते हो, है ना, पहले वो इंसुलिन की इतनी डोज पे था, फिर उसके बाद आपकी डोजेस कम हुई बिकॉज ऑफ द डाइटरी चेंजेस. तो सिंपली दैट वे, राइट. तो वो तो आपको पूरा एक ब्लड प्रोफाइल देखने के बाद ही यू कैन लाइक गो फॉर दैट, राइट. या तो डोजेस कम होती जाएंगी धीरे धीरे, ठीक है. ओके देन, that's all for today. Thank you for coming to the webinar. Hope you have learned a lot.
Thank you.
Yeah.
Yes, ma'am.
Thank
Thank
you,
you
ma'am.
so much.
Thank you so much, ma'am.
Ma'am.